Hi there everybody and welcome back to my channel. Today I will be talking about a condition called optic neuritis, which can leave patients with severely reduced vision, usually in one eye. It could also cause the appearance of washing out of colors. Patients may also find that they experience pain on eye movements. In addition to this, they may get some strange symptoms, such as when they bend over, they may get an electric shock type sensation down their spine, and also they may find that during certain activities such as exercise, or if they are taking a warm bath, that when the core body temperature rises, that can also cause the sensation of blurred vision. Also, they may find that when they look at certain moving targets, they may get blur that occurs with certain types of motion. So if you want to learn more about this, then please stay tuned. Thank you so much for choosing to watch this video. I'd be really grateful if you could support this channel by subscribing, clicking the bell icon, and staying up to date with my content. So the worry with optic neuritis always is it MS or multiple sclerosis? Clinically, what we use is a criteria called the McDonald criteria. This helps us to ascertain whether indeed a patient presenting with optic neuritis could potentially have multiple sclerosis. Multiple sclerosis is an autoimmune condition that has inflammation at its core, and what happens is that the nerves within our bodies that are covered with myelin sheaths, i.e. a fatty substance, this is targeted and lost through the condition, and as a consequence the functions of that nerve, whether it be helping with eyesight, whether it be helping with controlling hand movements, those things start to suffer. So as a consequence of inflammation and loss of myelin sheaths around nerves, function is lost within the body depending on where the attack is taking place. Now, this function may return back to complete normality, or it may be a case of it returns back to some kind of normality but not back to the original baseline. This depends on the type of multiple sclerosis that one is diagnosed with, and there are several different types. For your convenience, on screen now is a picture of a typical nerve which has a myelin sheath enclosing the nerve, and you can also see in the second picture that when the myelin sheath is lost, this exposes the bare nerve, and therefore the nerve is subject to damage. Optic neuritis is a lot more common in females compared to males, and the classic age group that it tends to affect is between 20 and 40 years of age. The classic symptoms the patients have is pain on eye movements, reduced vision, reduced color perception, and upon examination for eye care practitioners, they are looking for features of optic nerve dysfunction. In their history, patients may also describe a possible viral type illness that came before their dysfunction associated with their visual symptoms. After a careful examination is performed and clinical signs are elicited, patients go on to have further investigations such as imaging of their optic nerves. They will go on to have things such as MRI scans, and then more specialist tests such as electrodiagnostic tests, which look in fine detail at the nerves and how they are functioning in a specific part of the body. And they also can go on to have a lumbar puncture to look for telltale signs of multiple sclerosis. Importantly, patients will also have blood tests, and this looks to rule out other causes of a swollen optic nerve head, such as infections. What will then happen is patients are admitted to the hospital wards, where they will receive IV intravenous steroids for at least 3 days, and this will then be followed by oral steroid treatment. The aim of the steroid treatment is to speed up the recovery, and it will not necessarily mean that you will reach back to your baseline level of functioning. Although the vast majority of patients do make a good visual recovery, it is important to forewarn patients that this may not always be the case, and there may be a slight discrepancy in their vision. They may be aware of shadowing or scotomas or blurred patches in their vision, and it's also important to warn patients that due to the nature of the condition can come back. Importantly, patients should also be counseled about the risks associated with steroids and the side effects that they should look out for, including things such as elevated blood pressure, diabetes, and sleep insomnia, also psychosis. Thank you very much for tuning into this video about optic neuritis. I hope you've learned about how it can present, how it is diagnosed, and how it is treated. Again, I'd be grateful for your support in trying to grow this channel, so please do subscribe, give it a thumbs up, click the bell icon, and please do comment. I would be very happy to hear your thoughts. Thank you again. Take care.